So I knew lasers were going to be the future. And because I had been around the block a little bit as a dental assistant, I knew that not every, dental office and dental practice is the same, runs the same. So I kind of got a good feel for like the type of dentist I wanted to work for. And I was fortunate enough to come out and find a doctor who also wanted to be on the growth path and bring laser technology in. He just didn't have, the hygienist that wanted to do it with him. So the opportunity came available. We talked and he was like, let's do this. You're hired.
Welcome to the Oral Systemic Connections Podcast. I'm your host, Dr. Tom Larkin, here to explore how your oral health connects to your overall well-being. From heart disease to diabetes, your mouth is the gateway to your body. Let's dive in. Welcome to Oral Systemic Connections, where I introduce you to amazing people. Today, I'm going to introduce you to a hygiene superstar, Elaine Rodriguez from Arizona. Good afternoon.
Good afternoon. Thank you guys for having me.
Our meeting in April was a little bit of a pivot. Normally, it's a training meeting going over all these amazing things that are going on in hygiene. But this time I brought amazing people together, and I brought some senators and a new dean of a dental school. And the purpose was to get in front of some legislatures who are going to be making decisions about prevention going forward. Okay. And it really turned out nicely. You represented the hygienists so well. So Senator Frommeyer invited me last week to speak to the legislature when I wasn't expecting that. But so when they had their inaugural meeting in a couple of weeks, now I have my foot in the door to represent dentistry. But what she saw was that, wow, there are a lot of accomplished people in dentistry, right? And you were one of them. So I want to thank you for participating, and you represented the hygienist like you killed it. You really.
Well, thank you, Doc. I really appreciate you having me. And on behalf of the hygiene community, we are so grateful for doctors like you who really see our value, respect what we do, want to keep us and really take care of us and support what we do for the patients, for the dental community, and for dentistry as a whole.
Yeah,
so
100%. I was so happy how everything turned out. I was kind of nervous going in because it was very different, right? But it accomplished what I wanted to, because I'm apolitical. I don't like politics, but I thought, well, if these people are going to be making decisions, and especially it's about prevention, right? So RFK's mandate is shifting models to prevention. I said, we got to get in that mix. Somebody does. So I got to put my hand up and say, can I get my foot in the door to express my opinion around all these amazing people that I know? Because if it's not me, who's it going to be, right? Somebody else is going to, they're going to make uninformed decisions. And we're going to talk about uninformed decisions in politics a little bit later. But first, I want to start out like I do with everybody. And I want to talk about your journey into dental hygiene. So at some point, you were inspired by someone to get into healthcare. Can you kind of help me understand who that person was that, that you saw that said, hey, that looks cool. I want to be that person.
So coming into dental, I initially wanted to just get into a professional space. So I didn't think that professional, university was going to be for me. So I was really just thinking, where can I get into a career path that is going to, lead me to, higher earnings, more professionalism, grow, personally. And so I actually started off my dental career as a dental assistant. And I was a dental assistant to a prosthodontist. And very quickly I realized, there's some disease that's causing these young patients to lose their teeth.
Yes.
So the personal drive was really just to seek, a quote unquote career. But once I got into that space, I recognized, the value of dental and what is dental disease and how does that impact the person in emotionally, physically, and health-wise. And so seeing people as young as like in their 30s lose teeth and even being, a young dental assistant, I didn't understand what periodontal disease was. So that's actually what pushed me into going, furthering my education in dental hygiene because I wanted to work more closely with the patients and I wanted to focus on prevention. Like prevention was my purpose going in.
So tell me about so become a hygienist, the shift into dental laser integrations, because this is This is a big deal. You've been on this path for a decade. Is it 10 years?
Yeah, it's been a good while. So going into laser, so in school, I did my capstone project on laser technology, and this was back in 2009. Okay. So I knew lasers were going to be the future. And because I had been around the block a little bit as a dental assistant, I knew that not every, dental office and dental practice is the same, runs the same. So I kind of got a good feel for like the type of dentist I wanted to work for. And I was fortunate enough to come out and find a doctor who also wanted to be on the growth path and bring laser technology in. He just didn't have, the hygienist that wanted to do it with him. So the opportunity came available. We talked and he was like, let's do this. You're hired. And I was very grateful to him that he invested in me, took me out to several certification courses through the World Clinical Laser Institute and paid for my travel. And I mean, this is expensive education, right? So fast forward, coming back into our own practice, it really just started off as like very self-serving. I wanted to be able to take days off and I needed, someone to be able to see my laser patients, see my patients and take care of them to the same degree, that I was getting them to. And, I needed other hygienists to be able to come in and work alongside me. And what I realized was people would come in and say that they were laser certified, but they really truly, didn't know what they were doing with the laser. And you see it again and again. And this isn't the case where you want to fake it to make it, like it's really not. So really what led me into creating dental laser integrations and creating an education platform was to make the training affordable, accessible, but high quality so that everybody can learn and do what, we do.
Yeah, well, you've put in the work. It's very evident to me that you've put in the work, and I know how much work goes into like learning platforms and stuff. And you're extremely detail oriented, and you've put in the work. So, laser therapy in dental, how is it different than conventional therapy? Because everybody always asks me, unfortunately, and you know this too, there are still a few states that are uncertified or you can't the hygienist. I don't know, big states like Florida, Texas, so that comes up. So when I'm doing my training, that people will say, what does the laser add to it to conventional therapy? And I always look at it. It's like a ladder of thoroughness, right? It's just one more step. Some periodontal therapy, I guess you could look at it as being redundant. You irrigate, but laser is different. Laser is an additional therapeutic value. Can you kind of explain what that is?
Yeah. So I always want to start with what, realm of treatment are we doing? Is it restorative? Is it surgical? Is it perio? Is it preventative? So, in terms of what we do for hygiene and in terms of using lasers that are soft tissue oriented. So, soft tissue lasers for periodontal therapy and for preventative and therapeutic purposes. So, what does it do? Well, firstly, we have to look at the technology. It is a soft tissue instrument. So, in terms of traditional modality, everything that we've done, with in the realms of periotherapy is scaling and root planing. It's everything oriented to the hard tissue. So we have all these great cavitrons and piezos and, scalers that are treating the hard tissue. But what is it doing for the soft tissue? Now, I know there's other treatments now like desiccation therapy. We have ozone therapy. All of those also lend to treating the oral environment. But what does laser do? Laser, when it comes to periotherapy, there's two top treatments that a hygienist can do. The first one is photobiomodulation. So in terms of the biofilm incidence in that area. So that's what that does. But more importantly, I want to put more focus on the sulcular debridement. And so not to confuse, but this is primarily debridement of the soft tissue, and that is buildup of scar tissue that forms on the inside of the gum pocket when there's injury or wound or infection and disease. So to understand all that, we have to kind of really think, well, if I'm treating the teeth, and I'm doing scaling and root planing, what am I removing? I'm removing tartar, I'm removing calculus, hard deposits from the surface. When you use soft tissue lasers, the first thing I want to touch upon when we start our classes is, what are we treating? What are we cleaning? We're cleaning dirty scar tissue that forms on the inside of the gum pocket. So there's a little bit more obviously that goes into it, but those are the top two treatments. And when you combine them is when you get a regenerative effect. So Dr. Larkin, I'm seeing patients that are getting 4, 5, 6 millimeters of reattachment. And you just do not get that when you're doing traditional scaling and root planing alone. You're just not going to get that.
Right. Because you're looking at the biological, right? There's that whole thing that goes back many years that it was thought that periodontal disease was caused by calculus. Well, the stuff that's going on. So it's a root cause. You're getting to the root cause, and it's very efficient, right? When you take the dental teams through this process, your educational process, can you give me kind of a 30,000 foot layered level view of it? Do you educate the whole team, or I know you do different types of things.
Yes. So we want to be able to educate everybody, especially if you're coming from a practice like mine, which is private practice, where it takes a village. Everybody needs to have the proper training on whatever tools and services and modalities that we are implementing. So ideally, everybody gets trained from the doctor. The doctor has the fiduciary duty to oversee the hygienist. So it's really important that the doctor understands what's going on, in the hygiene chair, from the clinical assessments all the way down to the treatment planning and the use of the laser itself. And that's what the bylaws read. So it's kind of like, I love dental boards to require training, but I also like that they put in there, usually the doctor has to have equal or more training than the hygienist. And so when I go in to do training, it really helps bridge the connection between the doctor's treatment philosophy and the hygienist. So then, of course, we train hygiene within their scope of practice to do all these, treatments from perio to pain management. And it's important that the hygienist, of course, not only understand the laser as a tool, how it works as a device, the settings, the parameters, the techniques, and all those hands-on pieces, but more so, Dr. Larkin, which is why, I even am grateful to be connected with you, is understanding the body, understanding the patient, understanding the disease that we're treating. So what does that really look like? Understanding the patient's medical history. And now we're knocking back on the oral systemic connection discussion. It's understanding how are we diagnosing periodontal disease and not just like being negligent and tiptoeing over it. And if you really look at it, there's a lot of perio that goes undiagnosed in practices. And it's because it's not an easy conversation. It's a very delicate conversation that you have with somebody because they have a live infection. And it's often not caused by, you don't floss or you don't brush properly.
Right.
It's a more sophisticated conversation. So
100%. 100%. So for the most part, it's not covered by insurance. And you and I we had fun with a webinar called The Perfect Marriage, and how I was explaining that, my wheelhouse is showing the bacteria on the screen, and then, hey, what's recommended treatment? I find my personal experience is just high level of acceptance for the laser therapy. People, for whatever reason, they don't push back on it, and so from a standpoint of, when we're talking about this shift, taking a practice that doesn't have a really strong perio and moving toward a more periocentric practice, these are all really solid tools that there's an ROI on it. This is a business, you have to make money. That's not necessarily always my motivation, but I have to assure people that, yeah, this is going to work out. People are going to accept it. And it's getting into that mindset of, we need to offer our patients the best. We can't practice PPO and dentistry. It's not working for people, right? At a lot of different levels. So what has your experience been with case acceptance on, hey, I need to do laser therapy?
Always great. Okay. So when I first started implementing, and I'll speak for myself, when I was that 2-year out of school graduate, just still kind of learning and wrapping my mind around the piece of technology that I'm using now. So because I didn't have yet a deep understanding of what the laser does, what its purpose is, so when I took my initial classes, maybe they did, and it just was my learnability and my coachability. But in any case, I didn't leave those first couple classes really understanding treatment planning and disease management and patient management.
Right.
And I didn't really have an idea on predictability and what should I expect to see from this laser treatment. So a lot of it was like me just going back, implementing, and just focusing on the science. And when I would see the results for myself is when I really got better at explaining and setting those expectations for the patient. So in terms of case acceptance, once I under had a better understanding of the technology is when I was able to speak more eloquently and come from the approach of I'm a clinical consultant educating you on a best modality on a treatment that's going to be right for you and setting those clinical expectation and outcomes. Now my case acceptance is through the roof. And it doesn't matter if I'm in, a lower socio demographic of the city or if I'm in the most affluent, area. You can implement anywhere, and it doesn't matter if you're in low income or not, as long as the price is right, and most importantly, as long as the assessments are on point,
Yeah.
and as long as you have that understanding of what the laser is going to do for that patient.
Yeah. So, these are the thoughts that are rolling in my mind. All of these things take time, so right now and we're going to talk about this later, this whole divide on the value of a hygienist and then trying to fit into these PPO models. I just need people to understand that if you take the time and you train people up like you do, this works. People do not push back on this. They don't, if I convince this. So where do you see lasers, 5 to 10 years out? Does this to me, it's a logical standard of care. There are a lot of things to me that it's like self-evident. Don't you see us kind of moving toward that? I don't.
I do. And I saw it in school, like 15 years ago, and I knew this was going to be the future. And now we're in a day and age where offices like look you up before they even come in. They're looking at our reviews, they're looking at your list of services, and they're treating it like a restaurant. I want to see what is the ambiance, what are the reviews, what's on the menu. And this is something that the 2025 dentists and hygienists, the hygienists need to take responsibility for these services because we are the provider of these services. So it's really important that we really kind of take ownership of it. And the main reason being people are going to come in expecting it and wanting it. And there's a big push right now in the community for red light therapy, and people want more holistic, natural healing options. And we are gone are the days of just wanting a prescription and just a band-aid solution. They want to get healthy. So I think in the future there's going to be a bigger push for bringing in these holistic remedies and management options. But the reason why we're having pushback requires some introspect and some self-evaluation. Like, why aren't I offering this?
Right.
Why am I so concerned with what insurance will or will not cover? I want to say it's the owner that really puts so much emphasis on what insurance will and will not cover because
100%.
it doesn't matter. It
So,
doesn't matter.
so the reason why I was smiling just a minute ago, the reason why I was late for this podcast, you were very patient to wait for me.
No, I appreciate you.
I was on a previous call on photobiomodulation on new technology. And I was so engaged in this thing and I lost track of time. I guess, I got a podcast with Elaine. I was like, but it was on that. And I was like, and it's like, yeah, this is, and so my job is to meet amazing people like you, help you get a platform, help these people get a platform, bring it all together. Let's have this amazing meeting and share in a real positive, uplifting way the future. I'm so impressed with you. 2009, you saw the future, and I have a slide from a presentation that I made in 2009. I saw this, I saw all this happening, right? Not everybody does. And that's one of the things I have, a lot of respect for you. We have a little commonality. He was like, I can invest all my time and effort in becoming an expert because the world will eventually come to me. And hopefully that's where you need to be right this minute. So, but anyway, photobiomodulation. I have trouble with that word, for whatever reason, but that's why I would wait. And I apologize to you for being that. No, that's cool.
Red light therapy, doc. Say red light therapy and people will know it better than that.
I'm a big proponent of infrared sauna. I've done it for a lot of years. And I bought a new unit this year that had red light therapy in it, because I was like, I'll kill two birds with one stone. So these two really smart docs were saying, oh, can't do it at the same time. You have to do one and then the other. And they were explaining it to me. I was like, Oh my God. So anyway, yeah, red light therapy is, from what they talked about, it has to be on the radar.
We have to be equally as competent and confident in the science and the understanding so that we can be the ones that are, internally promoting. And this is like another, problem that I have where we think dental, and then alongside me seeing the vision for the future is when this concept of dental marketing started becoming a bigger thing and wanting more Google presence and SEO and these like buzzwords that we're using. And really, truly, I'm like, I don't have a brochure that I'm going to give you. I can give you, some marketing material so that you can post it around your office, and I can meet with your IT guy one to one and tell them what to put on your website. Yes, we do that. But it's a band aid. I want to teach the team one to one, patient to patient interaction. How do we screen? How do we educate? How do we individualize the treatment? Because not everybody, thinks they want people come in wanting a certain thing. So it's really important that each individual provider understand what the technology does and who it's meant for so
Right.
that we can have those individualized conversations because patients are not just going to want to come in and be sold, the thing that everybody gets. They still want that individualized, personalized care. So
So smiling again, you're making me smile today, which is an awesome thing. So you met Dr. Rachel Riley, and that's the practitioner here. I helped her with her startup. Within 5 or 6 years, she's closed to new patients. There's a waiting list. One of the things that she started doing a few months ago, and she's kind of shared it with me, now patients apply to become on the waiting list. And I was like, who came up with that idea? She goes, yeah, my team and I, we were talking. We said, let's just have them apply. So she shared with me these applications, and I said,
mhm.
I put some of this in my presentation. I won't use any names. It is astounding to get into the minds of the person who's out on Google, on Dr. Google, and looking, and I have all these quotes. Dentists would be shocked to know that people are that savvy, and they're saying, "I'm applying to become a patient. I'm applying to become a patient because I feel that the mouth is connected to the body, and I want a dentist that understands that." And I'm like, "Holy crap! You got to be kidding me!" And I'm just saving all these quotes because you and I know that there are people out there. The dental community doesn't know that. They don't understand it.
Yeah, a lot of offices are still hung up on, oh, my patients only want what insurance isn't
Yeah, no, it is.
covering.
It's all up here. It's
Yeah.
up here. Yeah. So and this leads me to my next question. What's the biggest challenge that hygienists face in adopting lasers? Now I can tell you in any technology, whether it's the microscope or the laser, whatever, it has a lot to do with the dynamic between the owner dentist and the hygienist, right? So the
Yeah.
hygienist might go to, RDH under one roof, which is mainly hygiene oriented, and come back to the owner and say, man, I really want to do a laser or whatever. So what are the obstacles? What's been your experience? Is it mainly the convincing the owner, or I've seen it where the dentist owner calls me and says, would you please have a Zoom with the hygienist? They're not on board, right?
Mhm.
So tell me your experience. Is it a little bit of both, or
So I'll say three things. It's the top three. One, let's start with, we're dealing with living per people like team. Okay. And you're dealing with a very insurance driven, industry.
right?
So it starts off with, lack of education and training. So the person who's not using laser is the one who is not seeking that knowledge. Like there's no one in 2025, if you're looking at the research and really unbiased looking at the research and the evidence, lasers are highly effective. Okay, so that being said, either you're very complacent and you just don't want to accept something new because it does require you to put in additional work and effort and output to get that patient to say yes. We're dealing with a very complacent individual if they're not wanting to move forward with bringing on this new modality. Why is that person complacent? Well, could be, that they've worked for a series of providers that unfortunately didn't build the trust, didn't feel it was necessary to invest in their people and their team and give them access to training. And I really do believe it's a trust issue on the leadership, on the owner. And on the flip side, I've seen owners buy $50,000 worth of lasers, and the hygiene team will not use it because it's additional work. I don't have time. I mean, there's all these infrastructural, operational issues. And it truly is, and every team that I work with, we build in bringing in an assistant for the hygiene team. So if you have three or more hygienists in the practice, they need to have their own assistant.
Nice.
So why is somebody complacent? It's not always that they're complacent or unwilling. It's just they're in a very high stress environment. And to do one more thing is like, it's asking a lot. And it truly is, which is why I don't say lasers are for just everybody. I think it needs to be brought on with some really solid foundational clinical systems in place before you overwhelm and break the system, because it can do that. There needs to be education, leadership from the owner to set parameters, to set expectations, set goals. Okay, like there's a lot of people that are externally motivated, and what's the problem with offering your hygienist more money when they're producing hundreds of thousands of dollars for you with this treatment? So it's those two things: not having the right infrastructure and clinical systems in place to support the hygienist scalability, which is adding on new technology, new services, because one laser usually brings 4 different streams of services and income. So, and that's a lot if you're already taking a busy, hygienist and stretching them even more thin. And then the lack of trust between the clinical protocols and assessing and co-diagnosing. If you look at the dental board, a dental hygienist usually doesn't diagnose perio, they co-diagnose.
Right.
So that is a big issue too, not being on the right page with the diagnostic criteria. I could go on and on, Doc, but really I would say those are the top few that really get to it. Because
Well, I think what you've done is you, in a very nice manner, you've described what I call alignment. It just
yeah,
kind of has to be a top to bottom alignment. And if there isn't alignment philosophically, clinically, systems wise, it doesn't get glued together properly, right?
right.
And when it does, it's a beautiful thing. But like you said, it's not for everyone. But what people need to know, because we have we have this division in dentistry. I don't think there's any question about it. These people in this low reimbursement environment struggling, and they're suffering, and the hygienists everybody's suffering there, and they don't really know what to do, right? And so some of the things that you and I are so committed to is pulling them, raising them up and saying, look, there is a different way to practice. And I know a practice that has a waiting list and you have to apply. And they would say, you're crazy. You're out of your mind. Okay, that's not possible. It is possible, because I've said it for 10 years. There are more people looking for this more thorough level of care than there are dentists trained to provide it. And that kind of, takes me to the course that I kind of developed to kind of fill that void. What does that look like? What does that practice look like? Salivary diagnostics, laser, ozone, all those pieces, parts. Obviously, this has been a hot topic the last couple of months, meaning a couple of states have taken, because of the perceived shortage of dental hygienists, they've taken action for whatever reason to have a lesser trained individual to take on some hygiene duties. So I don't want to misquote anything. So can you explain those initiatives? Like there was one in Arizona, one in Nevada. Is it a preventive assistant, oral preventive assistant? I don't want to get the terminology wrong, but explain the name and what they are potentially being licensed to do.
Yeah. So, in response to the dental hygiene shortage, the local dentists in certain states, and primarily Arizona — I'm from Arizona, so I'll speak for Arizona — have got in touch with the legislature to bring forth this oral preventative assistant. So, what is an oral preventative assistant and what can they do? So, an OPA is one that can probe, do supramarginal scaling, and document findings of disease. And so this is really in response to these practices that don't have a hygienist, can't keep a hygienist, can't find a hygienist. And really the way the legislation reads is it's for areas that are rural with a population of 250,000 or less. So they try to say, what is this person and what are their duties? Now looking at what is their education and where do they get trained is what's been recently on the docket. So they have to be a certified dental assistant. So, certified dental assistant is one that wasn't just off the street and on the job trained. They've gone through an accredited school to receive their designation as a dental assistant through the Dental Assisting National Board, which is DANB, and they have gone through an x-ray certification program, so they are able to take x-rays, and they have also gone through a certified dental assisting program, which also requires additional hours to receive that CDA designation. So they almost operate like an expanded functions assistant. And then if that person meets that criteria, they can then go into the OPA training program, which is through a CODA accredited school or institution. And they have to have a minimum of X amount of hours. And I believe they settled on 120 hours of education. That includes, like, you know, and the current curricula is still being developed, but essentially it's going to be teaching them instrumentation, probing, and supragingival management of calculus.
Okay.
Yeah.
Okay.
And hygienists are outraged.
Yeah. Well, it should be, because, from the very beginning, the premise is incorrect in that, you're dividing this. I'm just thinking conceptually that, it's above the gum. You can do this because you can't do any damage or with less training. But biologically, you can't separate the two areas. You can't separate the gum from below the gum, And so, so what I see, this is me looking out saying, okay, I see a fast-paced PPO thing that this just becomes a standard, Jiffy Lube cleaning, right? Everybody comes in and gets the same thing, and above the gum, and I just see from a health standpoint, just everything going down. I mean, I don't see the fit. You'd have to convince me of where that fits.
Well, it's a problem on many levels. Well, number one, aside from my ego as a clinical hygienist, let's put that aside and let's put the patient first. Like, is there actually a shortage of dentists who have the ability to get a patient in and get them treated? Like, are we meeting the need? Like, that's the first thing that people should ask.
Yeah.
And dental boards ask that, are we able to provide services? What's the need? And then they also ask, what is the cost for us? So, of course, they're going to look at cost. But all that to say, now, if they're coming in, are they seeing a skilled, professional provider? And at that, are they going to be treated to an endpoint of health? And truly, in all my years of dental hygiene and treating periodontal disease, I have yet to come across a case that does not seep below the gingival margin. Correct. And so in all my years, being in this dental field, I can already see who would need or who this would benefit, or an OPA, who would hire an OPA. And I could tell you it's no one listening to this podcast, because your people and my people really value the oral systemic connection. They value quality diagnosis to the root cause and to the end point of health. And the doctors that I work with, they're just not concerned with hiring an OPA, or even more so, they're not concerned with hiring somebody that isn't open and attuned to learning advanced modalities. And I think everybody wants to, like, buy the new toy, the new technology, but they need to invest in their people first. And this is why, looking at root cause, pun intended, like, the reason why we have this resignation crisis and the Great Resignation is because there were a lot of poor working conditions and hygienists were not wanting to come back to work. So to really take a look in the mirror and see, like, what kind of systems and working environment and vibes and energy am I bringing to my practice, and what kind of vision am I creating for myself and my patients, so that I can find the right team to support that standard of care. And so I believe there's a benefit for OKs, and maybe this is the entrepreneur in me, maybe this is the unbiased, operator in me. But my colleague and I were like, before they decided that there should be a CODA, it's only a CODA accredited institution. Okay, because I'm a secondary clinical institution, but I'm not accredited at this time. So that being said, we were like, well, should we create a program? Should we, train assistants the right way? If they're going to do it, let's make sure they're doing it the right way. And I'm going to say, I'm going to, be a little blasphemous, if you will, and say, I think assistants are very coachable, even more coachable than some dentists and hygienists that I've worked with, because they don't have all it's a double-edged sword. We want them to have all the skills and all the science and the acumen. They're just more inclined to execute and move forward and do it and just get it done. I'm not saying they're not coachable. I'm not saying they're not trainable. And if they are, God willing, they get the right training and the right education. And on top of that, they work in a great environment that's going to support, them and make it beneficial. Do I think it's, it's here to stay. It's going to happen. Why am I going to cry about, spilled milk already?
Right.
Let's this in a positive. And if someone's going to use it, make sure they're using this person in the right way.
I couldn't agree with you more. I mean, I think there's a blend of this that could work, but I think what you and I are cynical enough to know how it's going to be used, whereas it could be done. I would be like completely comfortable with you creating a course, or me, or both of us, creating a course of saying of an ancillary person doing stuff. Yeah. But
yeah,
I agree.
But I'll tell you what, Doc, like periodontal disease is a $1 billion business. And I feel like not a lot of hygiene, like there's so much undiagnosed perio that I see the other side of it, where I don't blame, dentists for wanting to go and find some type of solution, but why not invest in your hygienist? There's many hygienists that reach out to me like, I want to take your class, but it's, it's a big investment. It's a big investment monetarily. It's a full day of learning. You're missing a day of work. It's a big investment. And I love it when I see a doctor paying for the hygienist to come. But on the flip side of that, Doc, I've had hygienists come and like fall asleep in class because they binged Netflix the night before and they thought, oh, I have a CE day tomorrow. Let me just, show up like hungover, whatever, whatever we do. And we're like, oh yeah, I just have a CE to go to. This is not that CE.
No, this is not.
I'm telling you, I have to email when I put in the welcome letter, like, please get a good night rest, please, sleep well, eat a good breakfast. And of course we offer like, food, and we hydrate you, we feed you. I try my best to be as entertaining and engaging, and we have a ton of like interactive activities, but I'm not here to entertain you. I'm not an edutainer. Like, I'm here to show you the clinical business and get you on board. Like, you have to come ready to learn, like you really do.
That's a good segue. So I'm going to jump into our April course, because you and I have talked about this. So periodontal disease is a number one risk factor for prior periodontal disease is a number one risk factor for failing implants. And you and I have talked about this emerging. The placement of implants is, the market is like vertical, but trailing that is failures. Okay. And failures related to dysbiosis. Okay. So if you lost your teeth to perio, which a lot of, maybe, I don't know what percentage, but it's a high percentage. If you don't get your perio under control, you're going to lose your implants. Okay. And so you and I kind of decided that, that conversation, it doesn't affect necessarily the treatment. It's still the same oral systemic conversation. It's still the treatment of periodontal disease, but we need to make a little bit of a pivot. So let me show you the protocol for April, because I'm opening the course up here in the next week, and a little bit of the shift that I made. Okay. So this is our 2-day event, and I'm going to kind of show you a cool part. So we're making what I call Destination CE. All on X care, that's undefined. I see it on the message boards. What is all on X care? Okay. There is no standard. The dentists don't want to unscrew it, take it off, because it takes time, and strip the screws. There is no organization. Well, we need to have that discussion. Okay. When I went to ChatGPT, the operative word in everything that you and I talk about is biofilm disruption. Okay. Meaning that biofilm, when it's left unattended, tends to become dysbiotic and diseased. Well, for all-on-X prosthesis, according to ChatGPT, I said, how much of the surface area is accessible for biofilm disruption? And it's only like 20 or 30%. Okay. You can't get to the implants. You can't get to the integular surface at all. All right. Well, that's a problem. That's a problem. Years and years worth of biofilm buildup are going to be a problem. Okay. So implant maintenance protocols, air polishing /GBT, salivary diagnostics. I was on a call yesterday. I'm having some great calls that I'm going to share with you. There's a brand new test for implants. Okay. For implant specific salivary test, MMP8. I learned about that from Victoria Sampson, who you met at our meeting in April. This is a company in Germany, and this is an inflammatory biomarker that Pacific Dental is now doing on all new patients, right? And they were just talking to me about and once again, I'm a student, I'm a student on all this. Zirconium implants, Chris Phelps is going to talk about that. Desiccation therapy, you mentioned it earlier. I did a couple of webinars attended. I think that's an interesting, holistic, non-chemical thing. Desiccation therapy is cool, right? So it's for isolated areas, non-antibiotic. They'll stand by microscope. You're going to present on the diode laser therapy. And on the clinical side, when we have demonstrations on the second day, ozone water, Beldonine, the arterial ultrasound, and microbial therapy. Now, something I learned, you missed out on a few things because you had to get back. Your daughter had something going on. And your weekend was cut short, and I hated it because we really had a very cool networking deal.
Yeah.
And I've really seen this trend towards destination CE. And as you saw, Lexington's a cool city. April, the grass is green and it's all about the horse racing. So one of the things I did last year, which I learned a lot from, is that some of the presenters, Dr. Bale and a few people came in earlier, and we went to the races the day before. And it was super fun and it was super engaging. And so I want to open that up to anyone who attends if they want to come. So Thursday, the 23rd, I'm going to include, reserve seats at the races. And then I'm going to have the presenters will have a specific venue for that. Right. Friday is the conference at the hotel. And then Saturday is the clinical breakout. And then that's followed by a barbecue and networking event, because that was the part that you missed. It was really super cool. And then Sunday morning, for people that were leaving Sunday afternoon, as I think I told you, my neighbor is Sheikh Mohammed, the ruler of Dubai. And we went to his horse farm Sunday morning. And this is a week before the Kentucky Derby. And they were talking about his horse that was going to be in the Derby the following Saturday, and he won the Derby. So there were people that were on that tour that bet on the Derby and paid for the whole week trip. And then we had a luncheon at the Thoroughbred Club of America because, Victoria was staying over another day. So I want to make that available to everyone. It's of course, we're going to dive into where we need to be going, because like I said, addressing oral dysbiosis and implants is an emerging conversation. And I appreciate all your help. So some of the things that you'll be helping me with are, laser protocols around implants, right? People want to know what does that look like? People are searching this, right? And so one of the things that I'm going to do when this is all done is, we're going to assemble all this information for people. And this is where they're going to be able to come away and say, oh, now I get it, right? So this is where, that division that we talk about, the practices that get it, and the ones that are just kind of mired in that hamster wheel model, right? That's gonna be there, because you're a lot like me. You're a very highly ethically motivated person to help people and help the profession.
Yeah.
And this is,
I am.
and we're just going to continue to take that high road. And whoever wants to follow, I know how hard you work, and you'll do anything you can to help this conversation, and I will too. So I'm thankful that we crossed paths a couple years ago. Your work is amazing. I highly endorse you, and I'm honored that you're kind of, hitched your wagon to help me, because this is what you do is really important.
Thank you, Doc. And likewise, I greatly appreciate you again, highlighting hygienists like myself, giving me a platform to speak on, the various ways we can innovate in our op through the use of technology and the better conversations with our patients. And again, the purpose is not just, to help offices grow profitably, but it's also to give purpose back to hygienists. Like I said, started off as an assistant to a pros, seeing people lose teeth at 20, 30, 40 years old. And I'm really grateful for the opportunity to be able to bring it back full circle, because advanced pros is the future. And now it's up to us to kind of help educate on maintenance. And I know there's other educators out there in the space, probably one or two. And now, again, with the sole purpose of bringing more accessible, high quality education, not just to add it to your list of books that we have on the bookshelf, but to give you actionable information and clinical protocols that you can leave with so you can start using them, immediately. So that's what it is. So anybody who is coming to that, you saw the list there, get your rest and get your team, your entire team, because it's going to take a group effort to come in and get aligned on what all these protocols will be, and be able to leave and take it back and start making changes immediately. So
awesome. So how do people get a hold of you? Dental Laser Integrations is what's your email? It's Elaine at Dental Laser Integrations.
Yep. DentalLaserIntegrations.com, Elaine, DentalLaserIntegrations.com. And my phone number is all over the website. So send me a text, send me an email, or set up a call.
Well, thank you so much for helping me in my mission.
Thank you, Doc. Thank you. I'm grateful to be a part of it. And thank you, everybody, for listening.
All right. Thanks.
And that's a wrap on today's episode of Oral Systemic Connections Podcast, where we prove every week that your smile is way more powerful than you ever imagined. If you enjoyed this episode, hit that subscribe button, share it with someone who deserves to know these jaw-dropping truths, and leave us a review to help us spread the word. And remember, every smile you care for is an investment in your whole body health. Keep smiling, keep thriving, and I'll see you next time.